Thank you. Welcome to today's meeting, the first Health and Wellbeing Committee of 2025. Is it still too late to say Happy New Year? Now we're in February? Yeah. Happy New Year regardless. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you've left the building, the assembly point is on the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Before we get on to the business of the day, can I just take this opportunity on behalf of the committee to send our deepest condolences to Alina Round. Our thoughts are with her and her family, what I'm sure is a very difficult time, and I'll try and do her proud while she's not here, and we look forward to seeing her back when she's ready. So, agenda item 1, appointment of substitutes.
Chair, yes, I've got two subs. So Sue Smith is here for Linda. Paul Subject is here for Lena. Just say Alex Kinsley messaged me a little while ago. She's poorly, so unfortunately she's not going to be with us tonight.
Oh, get well soon, Alex. Okay, any declarations of interest? No. Okay. And other than our guest speaker, do we have any public participants? No. Okay. So if we move on to agenda item 4, the minutes from the committee on the 21st of October. God, that feels like a while ago now, doesn't it? If we just take each page in turn for any amendments or corrections. Page 1, page 2, page 3, page 4, and page 5. Nope, so we'll sign them as a correct and accurate reflection of the meeting. Okay. Right, so moving on to agenda item 5, we have Matt Fung, Consultant in Public Health, here to give our his update. Great to see you again, Matt. Over to you.
Thank you very much, Chair, and good to be back here. It's been a year, would you believe? It seems to have flown by, but yeah, here we are again. So if you'd like to put the slides up, we're going to go to this annual presentation, which hopefully you'll find of some interest. Not the Antarctic or whatever that slide was there, but yeah, this is, as I say, an update on indicators pertinent to Worcester City. And if you just flick onto the next slide, there's going to be a bit of an update around the FOF indicator. There's a public health indicators which may be of some interest. We're going to some kind of priority areas that we've picked out for Worcester City. We're going to talk about a new approach, this LSOA analysis. This is an area of developing work within public health that's really going to start to drive how we see priorities across the whole of Worcestershire, Worcester City included within that. And then we'll do a bit of a wrap up. So onto the first slide there. So this is a population pyramid of Worcester City. It's for mid-2023. And essentially the take-home message here is that we have an increasing population. Obviously, population has grown, but particularly when you project forwards, you start to see a large increase in the over 65 populations. That's going to rise by about 16% by 2030, and in the 85 population by 20% by 2030. So we are going to start to see, as I say, a changing population over time, but really it's to kind of drive home the message that we need to start to plan differently. We need to stop planning differently for a different population into the future, which is going to present different needs, different demands for services. On the NHS side, but also on kind of local authority and statutory services and VCS services as well. So that's kind of the population change. So if you skip onto the and again, great. I was discussing with Lloyd prior to this meeting and prior to the district collaborative meeting that took place just on Friday gone. And we agreed that we'd put in some metrics around changing indicators in Worcester City that we draw off the public health outcomes framework. They're public health indicators that we track in public health that really act as a bit of a barometer of what might be going on within a given region or city in this context. And you can start to compare and contrast against England and against other similar areas. So if you just skip on a slide, hopefully you can just about make out some of these metrics here. Essentially, these are metrics that we've kind of taken 21-22 data and as the base, so that's kind of the first pinky column there, and compared it against the most recent data on the right-hand side. So you can see that actually in 2021-22, there were a whole bunch of indicators that were significantly worse in Worcester City than England. And actually, there have been some improvements there in terms of the numbers now that are worse than England in Worcester City compared with England. So the two that were similar in 21-22 that are now worse are actually, it's in the middle there, admission episodes for alcohol-related conditions, which is a deteriorating trend. And then there's one there for bowel cancer screening. Now, this is where, you really have to dig under the direction of travel and kind of how an indicator is actually doing, because there it looks like it's much worse in Worcester City than England for bowel cancer screening. Actually, the rates have gone up significantly, around about 15% over that time period, yet it's still a little bit worse than England. That's kind of what that is saying. So I'm actually not concerned about bowel cancer at all, or at least bowel cancer screening in Worcester City. Alcohol-related admissions, though, is an issue. We do have a lot of drinking fairly casually amongst wider populations in Worcester City that aren't significant enough to be part of things like our substance misuse services. So these are people that are drinking, they drink casually, they drink regularly, and at some point their health deteriorates to such a degree that they need admission for an alcohol-related cause. So that's what that is saying there. Not just in Worcester City, it's across Worcestershire. So, as I say, a couple of indicators there that I just wanted to highlight. If we move on to the next slide, these are, again, a bunch of indicators that are performing significantly better than England in Worcester City. So homelessness and households in temporary accommodation, statistically significantly better than England. Physically active children, young people, this AAA screening, and a few other indicators there. So you can kind of see that, and it's to provide a bit of balance to say it's not all bad. Actually, there's an awful lot of good in Worcester City compared with England. So if we skip on another slide and another slide again, these are just a select variety of indicators that match up with the district's collaborative priorities. So around ageing well, around best start in life, and around health inequalities. So this is just one around falls. It's to say we're around about kind of Worcestershire average for falls in Worcester City. But obviously, as I mentioned earlier, this will become more of an issue going forward with an ageing population. So we need to be aware that this indicator will probably deteriorate over time if all things stay the same. If preventative mechanisms act as they currently do, we will still see an increasing level of falls. So we need to bear that in mind with the health and well-being of our population. Next slide. Dementia diagnosis rate. I think I presented on this last year as well. This is more of an NHS metric where we're not diagnosing as many people in Worcester City as NHS England would have us diagnose or think that we should be diagnosing. So it's an indicator that we need to work towards across the whole of Worcestershire, and Worcester City no different. Next slide there. Children in poverty, in relative and absolute poverty, is still a concerning trend in Worcester City compared with Worcestershire and the UK as a whole. Part of this has been exacerbated by cost of living, part of it's been exacerbated by COVID, and it's certainly a focus of what we can do and what we're trying to address as part of the district collaborative, but really requires a whole system approach to move the metrics on children in poverty. And on to the next slide, thanks. Again, a metric that is difficult is infant mortality. It's kind of been quite variable the last few years. And unfortunately, with the most recent data, we're going to see a slight rise in infant mortality again. This is a metric that we really need to be aware of. And again, it requires a whole system approach to addressing. But the ICB, the Integrated Care Board, which is the NHS, do have a specific work stream around best start in life and infant mortality. However, breastfeeding on the right-hand side is significantly increasing in Worcester City, and you can see the trend there, coming from well underneath England average to kind of pulling away from England, which is a great trend to have. Next slide. Overweight and obesity. This is a theme, a topic that we had a lot of conversation about at Health and Wellbeing Board back in November, and really it's a trend that isn't a good picture across the county. And you can see for Worcester City in reception, you can see that we start out at 22.5% of our children being overweight or obese, rising to 37.5%, which is the highest in the county by year 6. So in terms of children having the best start to life in terms of their own health and well-being, that's a metric that we really need to think about how we start to address and to mitigate. That said, I know Lisa, Director of Public Health, has mentioned this before. It's not the greatest language in terms of overweight and obesity in terms of children. I would prefer to talk about physical activity and healthy eating. I think that's a much better way of framing what is a complex issue for children in formative years in their life. So that's kind of caveat aside, that's the current picture in Worcester City. I just wanted to put in something on under 18 conceptions. Again, Worcester City versus England, absolutely kind of the right direction to be going in. The drop has been, astounding over the last 27 years or so. And you can see that trend is still coming down. Still some more work to go and some more way to go with that trend. But I think it's a great public health result outcome to see, under 18 conceptions come down like that. So on to the next slide, please. Really quickly on to a bit of a spotlight on community grants. So Public Health have been providing very small grants across Worcestershire to lots of different communities. You can see just about there's a whole bunch of grants within Worcester City. And these are really devolving some of the public health grants to community organisations to do great work within the communities that they live and that they serve. So what we're seeing is some great outcomes. We've been investing into schools, small grants to schools, small grants to the VCS, and it really covers a spectrum of different topics, having some great outcomes there. And it really, covers off, new play equipment for schools to investing in parkrun to keep parkruns going and to set parkruns up in different parts of the county. So a real spectrum of activity, but I think it's a real testament to the way that community groups kind of serve their communities so well and the outcomes that we can see even through these tiny grants that we're providing. So yeah, that's just to give you a bit of a brief there. So I just wanted to, as I mentioned before, have a quick conversation about LSOA, so lower super output area geographies. So the first slide here is basically a visual of we often have, across the NHS particularly, a way of distributing resource, which is to sprinkle resource equally across the geography, across Worcestershire. That's with a lot of caveats. Yes, there are some more locally commissioned services, so I don't want to kind of degrade those in any way. However, the lion's share of funding is given out like the top sprinkler system. And our hypothesis in public health is that perhaps the better way is to target resource if we want to see more potency of change in our population and in health outcomes, particularly for more deprived or kind of populations with higher health need. So that's kind of the representation from that kind of wide sprinkler system to the focused jet. There's evidence behind that as well to say that LSOA, so looking at lower geography levels, is a strong predictor of use of health and other types of services. So just onto the next slide. So really this is our approach to identify priority areas across Worcestershire, to identify gaps in support provision, essentially by looking at the data, but also talking to and with communities. So it's very easy for us to take data and to think up new programs or new ways of doing things, but talking to those communities is exactly what we want to do there on our approach. You then kind of work with communities to address those gaps. You evaluate and then you go back and have a look again to see which other communities need similar help. So that's essentially the approach that we're taking. It's nothing revolutionary in one level, but the application of what we're doing is very new. Just onto the next slide. So what we've done in the first kind of round of this analysis is to take emergency admissions, to take cardiovascular disease admissions, and to take respiratory disease admissions, and to triangulate that data together to give us our triangulated lower super output areas across Worcestershire. So these are communities up to around about 3,000 people, around about 400-ish households. So you can see that they're quite kind of tight geographies, often relating to just a few different roads within a community. And that essentially has given us our first tranche of data. Just on to the next slide. So for Worcester City, as I say, we've done this work, and where we've triangulated those three data sets together has essentially pointed us to brickfields, so the darker brown area in the map there. And that's the kind of first place that we want to work in Worcester City, around kind of working with that community to understand what might be going on in a bit more depth, what are the barriers to accessing services, what is the lack of understanding in which appointments people should be going to, uptake of preventative services like screening and immunisations. How many of these people have received a health check, an NHS health check in the right period of time? And where we've started to do some very deep dive work into other LSOAs across Worcestershire, there's a very low uptake of things like NHS health checks, less than 5 in some areas, to be honest, in that community, which is very, very low when you consider people without long-term condition over the age of 40 should generally be eligible for a health check. So it's really socialising some of the offer and what is available to people to help them to live the best life that they can. You can see how then this plays into when we talk about life expectancy and healthy life expectancy. These are the driving factors that influence those metrics that we're all concerned about. So this slide is just to profile a bit of brickfields for you. So we talk about IMD, so indices of multiple deprivation. These are the reasons why brickfields is ranked as an IMD 1 area. So the 10% most deprived area in the country, because of income, employment, education, skills and training, health and disability and crime. Those are the reasons that brickfields is IMD 1. So those are the things that we need to work at as a system collaboratively, including through the district collaborative, to really kind of, from a desktop exercise at least, to help that community. What we need to do is get out onto the ground and talk to people within that community. You can see there that it's a younger age structure than Worcestershire, mostly white population, higher level of disability, lower level of self-reported good health than Worcestershire. Quarter of people smoke, 15% of people are obese, 20% of people have a long-term condition, mental health condition, and 2 in 3 have a long-standing health condition. That starts to paint you a picture of that population in Brickfields. So 25% of people smoke. In other areas, it's kind of been 25 to 35% of people are ex-smokers. So then you've got the majority of the population are currently or used to be smokers, which we all know probably the association with poor health and the association obviously with a reduced healthy life expectancy and overall life expectancy. Again, in other areas, we're doing our work with, I'd say, with the GP practices around Brickfields. What I suspect that's going to show, and without preempting that data, what we've found in other areas that are very similar to Brickfields is there's a huge degree of anxiety, depression, as that says in the previous slide, people out of work, kind of familial or kind of generational, I should say, health issues that people find it very difficult to break out of. When you don't have a template for how you work, how you get a job, how you get kind of good educational skills and training, etc., those vicious cycles are incredibly difficult to break. And that's why, by targeting, we can potentially have a greater potency of effect. This is just a few ideas, really, that I put down on the slide, more for the collaborative, but for your information as well as part of this committee, around, we need a collaborative action plan. We need a joint action plan around Brickfields and other areas as they start to emerge using our new analysis. We need to continue to promote screening, health checks, cardiovascular checks, vaccinations. We want to deploy the Your Health, Your Wellbeing van, some of you may have seen on the road. So that's the type of resource that you can go, right, there's some streets over there, uptake is low for this, this and this. Let's go and do some of that directly with those communities. That's a real opportunity. Children's physical activity and diet. As I mentioned earlier, we really need to get to grips with that subject in Worcester City and work very differently if we want to see that curve kind of change direction. Otherwise, nothing will change. We'll continue to have, a growing problem in childhood health and wellbeing. Communities and engagement. We need to work with communities. That's the ABCD, asset-based community development approach there. Address social isolation, particularly pertinent with an ageing population. Economy, employment. Healthy Worcestershire is another opportunity that some of you may already know about, so relatively new public health programme there. Health and planning, active and safe travel, warm and safe homes and cost of living support and signposting. There's a whole spectrum of things there. It's representative and reflective of the varying needs, I think, within some communities across Worcester City. That essentially is it. If you skip onto the last slide, as I think I probably mentioned last year, a lot of this data is collected on our JSNA pages at County. So if you want to drill down into a specific LSOA, then you can do some of that through our site, and that's kind of open to you to access. So at that, I'll close, but really happy to take any questions.
Thank you, Matt. As usual, a fantastic data-driven presentation, and I think highlights the scale of some of the challenges that we're facing locally. I know loads of people are going to have questions. Edward, Neil, Richard. Okay. All right.
Thank you very much, Chair, and thank you, Matt, for the presentation. I think it's very complete and very insightful. I thought it was very important, actually, what you were highlighting around the challenges of deprivation, and obviously a lot of my colleagues, we represent deprived communities. My colleagues Adrian and Zoe particularly represent a larger part of Brickfields. Jill, Naz and I represent the larger part of Warndon, which also joins on to Brickfields. And we have extensive experience working with severely deprived communities. And we see on the ground level what the human picture of those statistics actually is. I think one challenge that I want to throw down, really, passing the message on from the residents, I think trust has never been lower And people in deprived communities feel left behind, left out. They feel that they are preached to and taught to, but they don't necessarily feel engaged in that process. They don't necessarily feel bought in. This comes to my mind because I had an email some weeks ago about a project being run in our area, which was not getting the take-up that was desired, and it was under the Healthy Worcestershire banner. And I remember reading that email and chuckling to myself and saying, well, I'm not at all surprised that the take-up is low, because there was no consultation with the residents or with us about how to put this together or what would actually work. I think that I just want to ask, can the feedback be sent into the team so that we know it's gone in there somewhere? That you can't helicopter in the help that is needed. It needs to be done in collaboration with the residents. They must have the opportunity to feed into the offer that is being made, that it needs to be delivered in collaboration with them. Local volunteers make all the difference in terms of getting people to turn up and participate. And we'd be really happy to facilitate and collaborate on that. Is that something that you can feed back into the system? Thank you.
Yeah, thank you for the question and comment. Absolutely. You know, when I think about Healthy Worcestershire, which is, as you say, very much part of what we're trying to do in public health, every Healthy Worcestershire site looks different to try and do exactly what you're describing, to reflect the community which they're working with and serving. As you say, we're very conscious of not doing to communities and working with. So, as I say, the sites are still kind of emerging and developing. They will flex and they will adapt to the needs of the community. So please do offer your feedback. And we can't do this really without communities and without politicians to help us along with that journey.
So if I might follow that up with an invitation, if there are people in the Healthy Worcestershire team or the County Council Health team, whoever you think would be appropriate to speak with us, we'd be more than happy to make our time available to discuss how we can make sure that the take-up in Brickfields and in Warndon is much better than it currently is.
That's great. Councillor Lawrenson.
Thank you, Chair, and thank you, Matt, for the presentation. So I've just been reading from the Local Government Association website about the two-child benefit cap. So the two-child benefit cap prevents parents from claiming child tax credit or universal credit for more than 2 children. It was introduced by the Conservative government in 2017 and is supported by the current Labour government. Data provided by the End Child Poverty Coalition shows that removing the two-child benefit cap would lift 250,000 children across the UK out of poverty. Do we have data that shows how many families would benefit from the two-child benefit cap being scrapped in Worcester, specifically Brickfields? Thank you.
Thank you for the question. I don't have that data with me today. What I can say is that, as you saw on the slide earlier, one of the key reasons for families struggling is because of household income, of which obviously child benefits, but other types of benefits contribute. Now, all I can do with the collaborative really is to help people, particularly within Brickfields and other deprived areas, to maximise the benefits that they're entitled to. I can obviously, as you know, I can do nothing about government policy, but what we can do is to help people to take up an offer that is accessible to them, or could be accessible to them, that isn't currently being leveraged or utilised to its full potential. Things like Healthy Start vouchers. We know that there's a huge number of families actually that are eligible for Healthy Start vouchers, but who do not take up that offer. And that has to be down to awareness of being eligible for that programme. So I think there are things that we can do. There's other things as well. We talked about fuel poverty, and there's things like getting Act on Energy and other kind of partners to really intensively work with communities that we see as more vulnerable as well. So you're right in that taking away benefits from more more deprived families that are financially challenged isn't going to help. but we can do something about maximising uptake of other benefits.
Thank you. I think to say the government supports it is a bit of a stretch, but Councillor Udo.
Yeah, it's a question that Labour does not support it. Labour wants to actually reintroduce or abolish the cap once it's able to do so. But, you know, I don't want to argue about words. The questions which I have, I could ask them about virtually every slide you had on the screen, and I've actually found it tricky to actually limit it down to just one or two questions. But one thing, I'll ask two questions on issues which you have not raised, I think, from the slides. An issue which concerns me greatly is the issue of social isolation, which is a growing problem, not just for the elderly, but for the young as well. And also can lead to over-dependency on social media, and then comes other issues such as the Protect programme and the problems which are associated with that. Have we got any statistics about that in Worcester City, about social isolation? We have got we are a very crowded city, but we're also a very lonely city if you haven't got any friends or colleagues or people to speak to. My second question, if I can be cheeky and ask two in one, you had the slide about children who are overweight and obese. I'm actually more concerned about children who are underweight and are not actually getting enough nourishment and support, and even children who are heading towards eating disorders. Again, have you got any statistics about that and how we can tackle those issues here in Worcester City? Lots of other questions I want to ask, but the Chair won't give me the time.
Thanks for the questions, as always. The other ones that you haven't asked, we can maybe talk about offline. Social isolation, you know, absolutely a key issue for Worcester City and the rest of Worcestershire, as you know. It's a tricky data set, isn't it? Social isolation, knowing that somebody is socially isolated, requires them to have presented somewhere to say I'm socially isolated. It's tricky. The NHS collects some data, so we have some data on social isolation. We're talking about hundreds, if not thousands of people, to be honest, in Worcester City who are socially isolated and lonely. But the data is only as good as the coding, and only as good as when a nurse or GP puts that data onto their computer system. There's probably a lot more than that, to be honest, that we're aware of. For elderly and young as well, I think we know probably more about socially isolated older people than younger people. I think, like you mentioned, social media and digital connectedness can sometimes mask whether somebody's socially isolated or not. They're tricky issues, aren't they? We're more connected than ever, yet we have more social isolation, arguably, than ever before. I think we need to be as aware as possible of people who may be left out of society. As you say, there is risk, particularly around extremism and kind of moving into prevent and that type of thing. For older people, social isolation and loneliness, you know, coming back to the comment earlier about Healthy Worcestershire, that's part of the point of Healthy Worcestershire. Obviously, Healthy Worcestershire is not going to solve social isolation all by itself, though. It will help some people in certain segments of society. It requires so much more than just Healthy Worcestershire, though, to solve this. It's a system issue and a system response that's needed to address. Underweight. I don't have any data with me right now. You're quite right, it is an issue for, thankfully, a smaller proportion of children. But that's why I was starting to talk about healthy eating and physical activity, because that ought to pick up both underweight and arguably overweight or obese children as well. It's on both sides of the spectrum. Language can be a barrier to action as well, can't it? Language can stigmatise, and language can, as I say, be a barrier to some of the actions that we need, which is why I think it's just so much more productive, conducive to conversation to talk about healthy eating and physical activity, not necessarily under or overweight. Unfortunately, that's what we have to use nationally. That's what we have to report. But you are right. Child poverty, as we were talking about earlier, the relative and absolute poverty slide, that clearly feeds into what you're talking about to a degree. Not entirely, because there are eating disorders as well, triggered through lots of different means. So essentially what we're talking about is very much more complex than just talking about are you overweight or are you underweight. There's so many complexities within that conversation. And yeah, one that we need to work with schools, we need to work with families, we need to work, as I was saying earlier to Councillor Lawrenson, we need to work with agencies, VCS, and organisations that we commission to make sure that people are accessing the right support at the right time, including benefits.
I totally agree with what you're saying, but the biggest tragedy for me is you can have the best system of education and advances in quality of education as you want, but it's completely meaningless if a child goes to school hungry. And unless we tackle the issue of food poverty, which we've got in this city, there's an aspects of it, we're not going to actually tackle the issues of the greater health concern. Can you give us any indication about breakfast clubs in schools in Worcestershire or in Worcester City, where they exist and where they don't exist, and whether the government's intention to actually roll them out to make them more regular, more often in every primary school, whether that's actually going to help assist or whether it will make no difference at all to the progress in achieving some goals in this area?
You know, really pertinent question. I don't have the data with me today. It's something that we could absolutely look into to map out breakfast clubs. Again, you're moving into government policy there to a degree, which is, I won't comment on that. I think we all recognise the potential benefit of things like breakfast club and after-school clubs, where food is provided, particularly to children who may not have eaten at home, to kind of set them up for the day. Now, I'm not sure about funding. I think a lot of this will come down to funding. How many children can schools afford to fund that can't fund themselves? I think my children through breakfast club and after school club, it's really expensive. So unless you get support with that, I think a lot of families wouldn't be able to afford it necessarily. So then you're coming down to where does that funding come from, and how are children supported who are, you know, in some of our more challenged financially families.
Thank you. Councillor Cochrane.
Thank you, Chair. Yes, thank you, Matt, for the very interesting presentation. My question is about LSOAs, and I really welcome the use of looking at smaller areas and looking at the statistics for those small areas, and that you can see on that map the difference in brickfields compared to other areas. But sort of with a caveat, I represent St Peter's Parish Ward, and that's green on your map. But I'm aware that there's small areas, smaller than an LSOA area of poverty that we're then missing. And I'm just wondering, is there data on lower level than lower layer? And do you see any value in looking at it down to street level?
The answer is yes, you can go lower, but the data often doesn't exist at kind of street level unless you go down to patient identifiable information. I should track back a little bit. The way in which we've done our analysis is using statistical process control charts. So I didn't want to get too technical for the committee. The reason that Brickfields has highlighted, along with a whole bunch of other LSOAs across Worcestershire, is because they're outside of what we call statistical process control, outside of control when you look at them on essentially a funnel chart, and you can see where LSOAs should be and where they shouldn't be, if that makes sense. So Brickfields is one that has flagged red, if you like, outside of control for, as I mentioned earlier, all emergency admissions, cardiovascular disease and respiratory. So basically 3 sets of data that we can potentially do something about, that we can offer a preventative element to. You're right, it's not reflective of every deprived area in Worcester City or Worcestershire. What we wanted to do was actually make it manageable for the system to get its head around, to say, actually, we've got an area that we can work on together. We can use this as almost a new kickstart of a new approach of working, and to deliver things very differently there. If we were to look at every deprived area, the problem with that is that I think people's heads metaphorically explode. That where do we start, and how do we address that? You're right, deprivation does play into this significantly. In fact, when we did our initial analysis, we didn't look at deprivation at all. We did it almost agnostic of deprivation. And it was just on which areas were outside of control, okay? When we overlaid on deprivation after we'd done all the analysis, it was striking. All of the, this isn't entirely accurate, but it gives you the flavour of it. Most of the most deprived areas were outside of control. Most of the most affluent areas were underperforming against where we would expect them to be, okay, in terms of emergency admissions. So that's essentially what happened, even without looking at deprivation. So going forward, we will be capturing more LSOAs as we get refreshed data sets and as kind of data changes over time. So other areas will be included, and we won't be ignoring other more deprived areas. It's just that this is the initial focus of this particular tranche of work.
Councillor Kimberley, did you have another question?
Yes, thank you, Chair. Thank you for indulging me. There was another pressing question which I've neglected to ask, and I really felt I must. In your data, you indicated that infant mortality was not only varying quite a lot, but also was quite significantly above the national average, or at least it appears to be on the chart. I'm aware of the phrase about how tricky statistics can be. How representative are those statistics, and do you have a read on why the data is so variable and so high? Thank you.
This is a really difficult subject and a motive subject as well, all at the same time. Every infant death is obviously a tragedy for the family and community. Let me start there and then kind of go into the response. With Worcester City, because there are about 100,000 people just over in Worcester City, every single infant death will appear as another jump on a chart like the one that I showed. So therefore, there's going to be a lot more variation in the chart than you would expect to see in England or at Worcestershire level. So it's not to say that there isn't a problem because it's just small numbers, because they are relatively small numbers, thankfully. The charts are going to look worse because of this relatively small population of Worcester City compared with Worcestershire or England. That said, we look into every death as a system, and we look into what are the causes, what are the factors that led up to that death, what can be done differently to prevent future deaths. So it's not like these go unaccounted for, every death is looked into, and lessons learned. If there are preventable things, sometimes there are just tragic events. It could be any number of things, but there's sometimes that are just tragic events. Sometimes it could be service-related, sometimes it could be parent-related, sometimes it could be an innocent accident. But as I say, it's something that we need to be aware of. We're not out of the woods by any means because, as I mentioned, the curve is going up again. I hope that comes down in the next reporting period. There are child death overview panel reports that are published on the web. So if you're interested in any of that further detail, then that's accessible to you.
We don't normally allow multiple rounds of questions, but I just think this is such an important issue, and your expertise and knowledge is so precious that I'm keen for us to get as much out of you while you're here, if that's okay. So I am going to hand back to Councillor
I'm going to thank you for your indulgence and then hopefully not take advantage of it too much. I've got two very brief questions which are following up from what I said earlier. First of all, both of these are hobby horses of mine. A lot of discussion about alcohol abuse and intervention to actually stop it and bring people back. There's very little work on what I understand or can see about prevention. And I'll be very keen to know what kind of preventative work we are engaged in order to prevent alcoholism taking place. And my second pleading for indulgence, you had a slide about breastfeeding on the chart. It's always a concern for me that I'm aware of the campaign that breast is best, but I'm also very worried that sometimes this becomes undue pressure on the parent who don't want to or for whatever reason can't breastfeed, which then creates pressure, stress and guilt. Which can lead into P&D. So I'm just seeking to be a bit of an insurance there that we're not putting undue pressure on parents to breastfeed when they can't or don't want to.
again, thanks for the questions. We're covering some ground tonight, aren't we?
Sorry.
Alcohol abuse, as you saw in the slide, that's been an issue. I've been in Worcestershire now for 7 or so years, and it's always been an issue. It's one of our metrics that seems to be quite difficult to shift. And I think part of that is it's normalised behaviour, to be honest. I don't know what kind of alcohol abuse you're talking about, whether it's kind of binge drinking or whether it's social drinking, but a bit too frequently. I think it's a very normal attitude. The other thing is that drinking alcohol has become relatively cheaper, not when you drink out, but when you drink at home. Those stats are, who knows? Apart from the national surveys, we don't really have a great handle, in my view, on exactly who's drinking when and what and with whom. So I would say it's a gap. Also on the intervention, I think it's probably a gap as well. You have obviously nurses and GPs seeing patients, and they'll offer advice on how many units you're drinking. You should probably cut down if you're drinking too many. And we have, as I say, those brief interventions that take place. There are campaigns that we hook into, kind of nationally and regionally. So we'll hook into those campaigns and promote them. To what degree that makes a real tangible impact on people who have those entrenched behaviours, question mark. Some of the data would suggest that it's not having a great effect, to be honest, because some of those metrics aren't moving. So one would argue, perhaps we need to do something slightly different. It's difficult when it's part of culture, though, because what we're talking about is cultural change, aren't we? So intervention is difficult as well, as I mentioned. Yes, there are NHS health checks, and people can go and have a check-up with their doctor who will offer brief advice. Whether or not people take up that brief advice, I don't know. I suspect people tell white lies to their GPs as well about how much they're drinking. I think people will always underestimate how much they actually consume. I think people will generally underestimate how much they smoke and probably overestimate how much they do exercise. I think, so you can question all of our metrics and data, to be honest. The point that I think you're trying to make is we probably need to think about different ways of intervening without people being turned off by the nanny state trying to control their lives. So it's a difficult balance. Breastfeeding, I'm sure if midwifery colleagues were here, they'd say, actually, choice of mums is absolutely paramount, and they'll be presented with the choice to either breastfeed or not. Yet the data shows the best outcomes for children are through breastfeeding. So again, in my professional view, the sway of kind of midwives and health visitors to promote and support breastfeeding, absolutely where possible, and where the mum is kind of up for at least trying, but it will never be mandated. It can't be mandated. But you are right, that conversation needs to be handled very delicately.
Thank you. I'm going to just finish, if I can, with some cross-committee discussion. We know that adolescence is a time where healthy behaviours can be set for life, and that it's a period where also unhealthy behaviours can start: smoking, drinking, risky sexual behaviour, all the rest of it. And we had a conversation with WCT last week in communities meeting, who are responsible for youth provision in Worcester. And Public Health give a sizable grant to WCT for youth provision. It was about £86,000, but they were telling us that they can only use 40% of it, so about £36,000 for youth work. And I think we know the benefits. The research tells us the benefits of open access youth work schemes, particularly for children in higher levels of deprivation. So I think there's a strong argument that youth work and youth provision is a public health issue. And so just really a plead for you to use any leverage you've got with the County Council and the ICB to really sort of maximise whatever we can for good quality, high quality youth work provision in the city.
Absolutely. You know, youth work is an important kind of service and collection of services for our young people. Obviously, public health can do so much in terms of influencing and swaying. I think a lot of funding sits elsewhere as well, not just in public health, obviously. So yeah, we constantly think about these issues with partners, and where there are gaps, we'll try and address them with partners as well. So yeah, something that we absolutely do and will continue to.
Thank you, and thank you again for coming to speak to committee. Thank you for your time, your effort, the real high quality of the presentation. I think it takes a little while to percolate. I know our WhatsApp group later on will be, pinging as we start to process some of the information. But thank you again for your time, and look forward to seeing you next year. Okay, so if we move on to agenda item 6, the Q3 performance report for 24-25. Tom?
Thank you, Chair. I won't go through the report in detail. I think members are fairly familiar with the performance reports by now. Just to draw attention, the first 3 items, the actions and projects, are all being progressed, and there's commentary against each of those contained within the report. In terms of the performance indicators, we do have 4 performance indicators which are shown as red. The number of ICS health initiatives is actually on target. I think if you to draw reference to the actual performance indicator, the target at this point is 12, and we're exactly on delivering 12 ICS health initiatives. The numbers helped through the Household Support Fund. We continue to deliver the Household Support Fund and the grants through that. One of the reasons for that being behind on the performance report is due to a shift in the measure. So it was previously measured by the number of individuals supported, and that's changed to households, so the target essentially far exceeds what is likely to be delivered for households. The number of awards for DWAS scheme, I won't go into any detail around that. We've got a report later on the agenda around the DWAS scheme, and the number of exercise by prescription referrals is also showing as a red indicator, and there's narrative around that. I wanted to just draw reference to a green indicator actually around the young people mental health support. That's a project which has been funded by this council for the past couple of years, delivered by Onside. That was funding which we identified became an opportunity from a reserve. It was a funded project for 2 years, but that's due to come to an end at the end of March this year. So just wanted to draw reference and identify, bring that to your attention. Essentially, Onside have been successful in securing an NHS contract, which will be providing mental health support for children and young people. So hopefully we'll go some way to mitigating the reduction in the council-funded service. I'll end there and happy to take any questions.
Any questions for Tom? Neil?
My first, am I? Oh, well, okay. Thank you, Tom, for the report. So I'm just referring to Appendix 1 on the projects and actions for 24-25. So the very first one is about accessible Worcester. So there's a lot of good work going on. I note that steps include engaging with disabled service users to test the accessibility of council facilities for mobility and visual aids. I just wondered whether actions will include consultation with autistic people in Worcester and other neurodivergent people in Worcester, including liaison with Worcestershire Autism Partnership Board in terms of making Worcester, the city, more accessible. I do appreciate that the action says includes, and you might well be doing all of this, but I just want to ask the question anyway, just to use the opportunity to advocate for people like me. Thank you.
Chair, if we aren't, we will ensure that we are, and we'll feed that back into Sian and Richard to make sure. But I know, given the extent and development of the work around this area, I would hope we've already got that included. But if we haven't, we'll make sure that feedback is provided directly to Sian and Richard.
I might be able to speak to that. I don't know exactly at this point in the project where it's at, but when we first met with Sian, me and Alina about getting the project off the ground, that there was an element of that. We were talking about places like the museum having sensory packs and different buildings having sensory packs, particularly for children. So there was definitely the thinking around that, but I don't know precisely at what stage in the project that will be brought in. But certainly we'll raise it with Sian just to make sure that it's not an oversight in the delivery of the project. Okay. Richard.
Yeah, again, it's probably a hobby horse of mine. It's the Active Travel Town Investment Fund and the issue regarding Kearpax Bridge. It's said here that it's virtually now open and running, but of course we've got the potential continued problem of lack of connectivity to the west side of the bridge, where the only means of access to it is normally by car, and which is forcing a problem on the west side of the bridge. I know the County Council said they had aspirations to extend the network of cycle routes to the bridge. That hasn't happened. It's still almost impossible to reach on the riverside. And for anybody from the Greater St John's area, would have to travel by bike along some of the fastest, most difficult roads in order to get to the cycle bridge. So I am worried that we've created something which can't be used from the west. Have we got any detail yet, information, on how accessibility and connectivity can be increased? Incidentally, not just for cyclists and pedestrians, but for the disabled as well. People with mobility scooters and wheelchairs are telling me they would love to go up there, but can't because it's not safe to do so on the highway. So it's becoming a significant issue locally.
Chair, David Sutton's just signalled at the back. We've not received any further information on this. I know it's a bone of contention for a number of our members, and I'm sure those members, particularly with City and County hats on, will be raising that at appropriate forums. And David, as our lead officer, can sort of feed that back to officer colleagues as well up at County. So that's being conveyed from a member and an officer point of view.
Councillor Murray.
Thank you, Chair. I've got two questions, actually. Shall I do them one at a time or both together?
Are they better answered one at a time or together?
Probably one at a time.
Do them one at a time then.
Okay, so first, the Household Support Fund shortfall. I just wondered what the key factors were that are contributing to that shortfall, where 4,064 people were reached with it, as opposed to a target of 9,000.
Yeah, it's a slight error on the report. Essentially, last year we reported the number of individuals supported through the Household Support Fund, and therefore we set this year's targets based on last year's performance. What ought to have been reported was the number of households, which is what the performance indicator relates to, and that's what we're now reporting. So it's not actually an underperformance. It's an issue around the setting of targets.
Okay, I understand. Thank you. And then secondly, with the rough sleeping figures, there was a spike in December, and I just wondered if there are any specific long-term interventions in place to address complex needs of homeless people, such as chronic homelessness, mental health, and probably victims of domestic abuse who are facing homelessness.
Thank you. So in terms of the rough sleeper numbers, I know there's been a lot of media coverage and, commentary on rough sleeping being more visible in the city in recent weeks. We have really strong partnership links in the city, so we work with a number of different agencies, both voluntary and statutory agencies, and we meet weekly as a partnership to gather intelligence and discuss outreach and discuss individual cases. So we are, you know, we have a really good understanding of what the need is out there. And our, you know, our firm impression is that there isn't actually a spike. It's become more visible in recent weeks due to a number of factors relating to the individuals concerned. But when we've looked at data going back over previous years, actually the numbers are very, very consistent with previous year's data. So, you know, I appreciate the concern that, you know, the visibility of rough sleeping can cause, and we've done some analysis of the individuals who are in more visible locations, and what we found is that 4 of them actually have accommodation available to them that we've sourced for them, or that they have available anyway, and 4 are out of area individuals who were then working with other districts or other parts of the country to try to reconnect them. All of them are working with services in the city, whether that's ourselves or ourselves in partnership with others, and all have been offered support and have support available. In terms of the complex needs that you're talking about, so that is a key priority for us. So in terms of rough sleeping, although on the face of it, it might sound that consistency in numbers of rough sleeping is actually not a positive thing, what we find is that we're very successful in addressing the needs of those who are new to the streets, and we're able to quite quickly put support in or accommodation in or reconnect them or whatever needs to happen. But we do have a core of more entrenched individuals who have, you know, really, you know, multiple needs, multiple disadvantage. That means that it's very problematic to find solutions, or who we've offered accommodation to and unfortunately have not been able to sustain it, for example. And we also have quite a flow of new people, new individuals. So although the headline figures might be the same, the individuals behind it are not. But obviously we recognise the need to address that flow. So we have been successful in the last few months in being selected to join the Making Every Adult Matter meme approach network. So that is around trying to affect systemic change to address those with multiple disadvantage, with, you know, really complex support needs, and recognising that rough sleeping, and particularly, you know, visible rough sleeping, isn't just a housing issue, that actually there's a lot of needs around that. So as you said, mental health, substance abuse, domestic abuse, adverse childhood experiences. There's lots of reasons why people are in that situation, and we can't resolve that as a city council or as a housing department alone. So we're working with a number of agencies, again, both statutory and non-statutory, across the city as a partnership to address that, to work more flexibly. So we work very flexibly in the city. So just had a quick check now and can see that, you know, over the last year we've made 21 discretionary placements to individuals who we don't owe an accommodation duty to, but because we want to resolve their homelessness have done that. So we've worked flexibly in that sense, and 2/3 of those have had a positive outcome. They're either sustaining the accommodation they're in, or they've been housed. But there are people within that who unfortunately are not able to sustain it. So that's where meme will be key, because a lot of the reason why they're not able to sustain it is because perhaps they've not been able to access the services that would enable them to do that. So working with mental health, with social care, with substance abuse, to make sure that they can put in flexible support as well. And we also have a specific team within the service whose role it is to look at specialist pathways for domestic abuse, mental health, prison leavers, young people, care leavers, because we recognise that there are complexities to those cohorts of people that, you know, we can't just fit them in a box. So we're looking at different ways to address that.
Councillor Kimberley.
Thank you. I hope I'm not going to go too far off-piste, but it just seems to me like a statistic that would be useful to have, or neat to have, but I don't know if it's quite covered. but I'm going to talk a little bit about page 16 on the report, thinking about rough sleepers and homelessness prevention. Obviously, there are some cases which don't necessarily get captured by this, where the housing team has managed to jump in and help people and prevent them from ending up on the streets in the first place. I'm thinking particularly of a case that was raised with us via social media, of all places, where someone was facing eviction at short notice through no fault of her own. What I wanted to ask more broadly was whether we anticipate a positive impact from the new government's policy to ban no-fault evictions. Will that help in tackling rough sleeping and homelessness in Worcester? Thank you.
I'm not quite sure this is this committee's responsibility, but are you happy to answer that?
Yeah, you're right. I mean, the homelessness in its broadest sense is covered within Communities Committee, and we report rough sleeping specifically to Health and Wellbeing Committee due to the specific additional risks that it can have. I mean, just in the broadest sense, in response to your question, though, we don't know. I mean, what we anticipate is that there will be an impact of the legislation. What that will look like and how that will be impacted, we're yet to sort of realise essentially. We anticipate there's probably going to be a spike in presentations for homelessness in advance of the legislation coming in, but that obviously would hopefully taper off once landlords were unable to issue no-fault evictions. So a bit of a vague answer, but unknown, though something that obviously we're very mindful of and keeping close attention to.
And just to apologise to the Chair in case I was off topic, I was just thinking in terms of the broad homelessness prevention subject. Thank you.
Councillor Sadiq.
Thank you, Madam Chair. It's the same related as rough sleepers about in page 15, yes. We are told that the number of the rough sleepers is down. However, residents have been reported seeing more bedding around the city centre, practically in shop doorways. Please, could we have an explanation for the gap between these stats we are reading tonight and public representations as the report in the press? Thank you.
I think we've probably already covered that from Rosie's answer before. Was there anything specifically that Rosie didn't cover that you want a specific answer to?
No, just want to say I'm like
Yeah, I think Rosie's explanation was that the numbers have stayed relatively static. There's a bit of a throughput of and churn of different people, but the team are providing the services that they need to either anybody who is new into the city or who've got particularly complex needs that need more than, you know, just one part of the package. Would that be a fair summation, Rosie, of what? Yeah. Is that all right? Right. Is it directly relevant, Richard?
I'm always relevant, whether it's direct or not, it doesn't matter. Barrel bikes, great scheme. Am I going to be interrupted?
We have got an update on the actual travel later on the agenda, so if we can leave it to then, that would be great. Okay. So if we just then move the recommendation that the Health and Wellbeing Committee notes the Council's Q3 performance report for 24-25. Happy? Super. Okay, right, moving on to agenda item 8 then, we've got the setting of the budget for 25-26 and the medium-term financial plan. I can't see you.
Thank you, Chair. So this is the next stage of the budget setting process, and members are being asked to consider the priorities in the service budgets relevant to this committee. With their support, we've got Appendix 1, which is a summary of the proposed medium-term financial plan and shows the current deficit of around 900,000. This will be met through the Financial Sustainability Plan, which was agreed at the Policy and Resources Committee last month. Then Appendix 2 shows you the capital programme for the next 5 years for the whole of the council. So members are being asked to consider the budgets and review any proposals for any new items or any amendments, these will be taken to P&R tomorrow through verbal update, I understand. Thank you.
Okay, if we've got any questions for finance about the budget? No? Councillor Murray?
I don't know whether it's a question or just a comment. I'm just concerned. I'm concerned that we are underfunding core public services such as Household Support Fund, Disabled Facilities Grants, food waste collections. Are they adequately funded? I mean, I'm no expert. It's just a concern that I have. And if I was making any recommendation, it would be, can we have some more money? But I realise it's just not there, is it? Everybody is underfunded.
I think we all feel that, and it's about, you know, going back to Matt's analogy of a spree versus a stream, isn't it? It's directing our scarce and precious resources where they'll have the most impact and the most benefit. But I think we all share your sentiment. Okay. If there's no other questions. Yeah, no other questions, we'll move on. If I take them 1.1, 1.2 and 1.3 together as a group, is everybody happy that we note the contents of the report? Yeah, super. Okay. Right, moving on, we have got agenda item 8 about the discretionary welfare assistance scheme on the back of Sarah's points. Is that you, Rosie, on this one?
Thank you. So this is the annual report that comes to this committee on the performance of our discretionary welfare assistance scheme, or I will say DWAS from now on because it's a mouthful. The timing of it is a little bit strange in the sense that it's reporting on the last financial year for which we have a whole year's report, so 23-24, but the report does include coverage of the current position also. So committee will remember that last year, 2023, we undertook a review of DWAS, and in last year's annual report, we brought the recommendations from that review, which resulted in a number of changes being implemented to the scheme, and those are summarised in table 2.1, and they've been in place now for over a year. In terms of the budget, so we have a base budget for our core DWAS scheme, and since late 2020 that has been topped up with various discretionary grants, and obviously in most recent years that's been a Household Support Fund, which has enabled us to enhance the offer that's available through the existing core scheme. So looking at 23-24 data then, we can see that similar profile of awards in terms of the type of awards made and who we're making awards to. So, you know, majority to non-family households, but still 41% to family households. And then tables 4.2 and 4.3 show a breakdown of the support needs of individuals who are being referred into the scheme, and then the referral agencies who are referring individuals to us. Looking then at table 4.4, I've included data covering quarters 1 to 3 of 24-25 and compared that to 23-24 and 22-23. And I'm sure it won't have escaped anyone's attention that there is a significant reduction in the number of awards made so far this year in 24-25. And this has been, 790 awards were made in the first 3 quarters of 23-24. So although we do see that we do tend to have a spike in applications during quarter 4, obviously because it's colder months, more applications for energy vouchers, even taking that into account, that there is that significant reduction. So obviously identifying that reduction, we've done further analysis on the referral data, and found that it's predominantly due to a significant reduction in referrals received from citizens' advice. So they've always been one of our main referrers into the scheme. So in 23-24, they accounted for almost half of all referrals to the scheme. But so far this year, they've accounted for only 7% of all referrals. So that has accounted for the significant reduction. Looking at referrals from other agencies, they've remained relatively consistent in terms of proportions made in previous years. So obviously we have met with CAB to try to identify that, whether there's a reduction in demand that they are seeing for that kind of support, or if they've identified alternative forms of support, which means that perhaps we could use the DWAS and Household Support Fund budget in a different way to meet an unmet need. And discussions are ongoing around that. The main takeaway really is that there is an alternative scheme for energy vouchers, which they have been referring their customers to, which has meant that they haven't needed to make referrals into the DWAS scheme for that reason. What I should say is that energy vouchers and food vouchers in terms of monetary value are a much lower proportion than the other support that we offer through the scheme, so in terms of white good provision, furniture, clothing and that kind of thing. So the energy vouchers themselves make up, in terms of budget, a smaller proportion. But we are continuing to have discussions with CAB around demand and mapping that kind of need and whether that alternative form of support is something that will be sustained. In addition to the Household Support Fund and the base budget, we've also had UK SBF funding allocated to the scheme this year. There was uncertainty, I'm sure you'll remember, whether there would be additional household support funding allocated for 24-25, and we did have quite late notice of that. So we had intended for the UK SBF allocation to make up for that potential drop in funding. As it happens, we've had household support funding allocated, and so we've been able to use the UK SBF funding instead to do some additional enhancements. So you will have seen in the very first section in terms of the scheme changes, we had removed the automatic entitlement of non-family households to a washing machine through the scheme. That has been reinstated. And we've also been able to introduce an enhanced resettlement package for households leaving temporary or unsettled accommodation. That will be in place until April. And we're also able to offer additional support with food and energy costs through the provision of additional vouchers. So whereas we do have a cap on the number of vouchers that can be applied for within a 12-month period, we can have flexibility around that, particularly during this quarter and the cold weather where needed. In addition to that, we have, using that funding, launched a Household Support Fund grant scheme, inviting applications from voluntary and community sector organisations to deliver direct support within their communities. So, having identified that there is this reduction and wanting to ensure that we are continuing to meet what the most priority needs are, what we don't want to do is duplicate or replicate support elsewhere. We have been doing some more proactive promotion of the scheme with agencies who don't traditionally refer in. So we tend to find, looking at referral data, that we tend to have agencies who are more likely to refer than others, who perhaps are better set up to refer because they already are an advice service and they're used to signposting. But we found that in particular schools and healthcare agencies, we don't tend to have huge numbers of referrals from. Obviously, those agencies are very, very busy, aren't necessarily set up to do that. So we've wanted to do more targeted promotion with them. And one of the potential proposals for the next tranche of household support funding would be to utilise some of the funding to enable us to part fund a post to be able to do that proactive outreach work with those agencies, take those applications, identify those specific needs to be able to meet those. and linked to what Matt Fung was talking about this evening in terms of the small areas that they're looking to target in terms of public health intervention. We also want to do some mapping of where in the city we're receiving the most applications from, to identify if there are particular areas of the city or more unrepresented communities who aren't accessing the support, and again, doing more targeted promotion and proactive promotion of the scheme there. And I believe that covers the majority of the report. Thank you.
Thank you, Rosie. Can I take questions? Yeah.
Thank you, Chair. Thank you for the presentation, Rosie. Excuse me. So yeah, my question's about the number of referrals from the CAB. So I'm just going to read it as I've written it down. So based on the number of household support referrals in the first 3 quarters of 2024-2025, we're looking at 24 household support fund referrals for the whole year, if I've done my maths right. And again, if I've done my maths right, that's a 96% reduction on the referrals for household support fund resources by the CAB in 2023-2024. Now that's a worry, particularly given what we heard in the presentation earlier in the meeting about helping people become more aware of the existing resources available. A 96% reduction in household support fund referrals from CAB. That sounds to me like a policy decision, a very deliberate decision. The question is, are there any initial thoughts before you have the dialogue with CAB why there's been such a massive reduction in the referrals to enable people to get support? Because 96% reduction is, that leaps out. Thank you.
One of the changes that we introduced as part of the scheme review was the introduction of a financial assessment, which asks for households' income and expenditure so that we can not only ensure that the scheme is targeted at those who need it the most, but also identify where there might be some non-priority debts, where we could signpost them for debt advice or give advice about budgeting, money management. To, part of the objective of the scheme is to not have people relying on crisis support, but to be more preventative. The introduction of that form is something that CAB has identified as what they consider a barrier to referring into the scheme. The alternative scheme they've identified doesn't have that additional step. However, as I've said, we have seen consistent levels of referrals from other agencies. Our own officers complete the form. We consider it as to be an essential element of the scheme to make sure that we are targeting the limited budget that we have at those that need it the most, and that is part of our ongoing discussion with CAB around how we can overcome that.
Thank you. I mean, again, it's more of a comment than a question. I should hope so, because otherwise people are going to CAB they maybe heard about someone accessing that fund last year and going, well, I really need the support. I will follow the path that my friend or family member has taken. They go to CAB and then they're hitting a brick wall. And it's like, when last year it was fairly easy, dare I say, to get the support. So I'd be really interested to know what the outcome of that discussion with CAB is, because otherwise people are being prevented from getting support. So.
Edward.
Thank you. Just looking at table 4.2, and I realise that because of the way that the table is set out, there is some data that you probably can't include or which doesn't directly relate, but which would be interesting to have. And you were talking about data that you'd want to capture. Do we have an overall sense of the age profile or the demographics in general of the people who are accessing DWAS? And is there any way that can be represented? Thank you.
Yes, so we do capture age, we capture ethnicity, we capture the address and postcodes of individuals applying again, as I said, that's one of the things that we want to kind of interrogate in more detail to identify if there are kind of more unrepresented groups. So yes, we have that available. We won't need to do additional work for that.
Any other questions for Rosie? No. Okay, in that case, I'm going to move the recommendation to note the report, but also importantly, if you see that it delegates any amendments to the scheme to Alina as chair and myself as vice chair as set out in paragraph 5.1. So is everybody happy to move that recommendation from the report? Yeah, super. Right, moving on to the final item for this evening, the Active Travel Plan Progress and Update Report.
Thank you, Chair. The report this evening is a report for noting on our Active Travel Plan, Action Plan. This is actually the last update report on this iteration of the plan, which has run from 23 to 25. So the plan is being reviewed by officers under the guidance of the steering group, the chair and vice chair, and Councillor Murray supporting that. And a new plan will be taken forward in summer and for coming years. The report also contains an update on the Towns Fund projects relating to active travel, including their Beryl Bike scheme, a number of other elements which have been mentioned earlier in the meeting tonight. I won't go into detail, I'll just pull out a couple of the highlights really. We've broken these down into internal and external actions, and in the appendix, for ease of reading, we've grouped those into completed actions and actions which are still live. And I'm pleased to say there's a good number of completed actions throughout that. A couple of actions we haven't taken forward. We were looking at an e-cargo bike for staff use, and we've been unable to really identify sufficient demand to justify that expenditure. But we're continuing to talk to Beryl about the potential for cargo bikes as part of the Beryl scheme. And we were at one point looking to allow staff to rent the council's in-house e-bikes for the weekend. Actually, since the Beryl scheme's been produced, that's really surpassed the need for us to do that. So we're making much more use of the Beryl scheme. So we've completed a number of actions around bikeability training. There's some sessions planned, which I think members are involved in as well in February. A number of things around promoting staff active travel, sustainable resources, and the shift scheme where officers and members can record their active travel and generate a small donation to charity. So over 4,000 kilometres have been registered from staff, and there's a carbon saving there of nearly 700 kilograms. We're doing a further assessment of active travel facilities using the Mode Shift Stars accreditation. So that's a formal assessment of our active travel. We've done plenty of work on that before, but this is the first time we're going to formally assess that. Then externally, a lot of partnership working. We're part of the Active Travel Stakeholder Group, which has been sitting up at county level, and we've developed a Worcester subgroup as well on that. We've got a number of partners attending that. We now have an active travel web page live on our City Council website, which has had over 21,000 views. And active travel is now built into our bigger city events. So the Victorian Fair and the Worcester Show will have an active travel plan for the show again this year. We're engaging with the County Council's consultants on the LC WIP, the Local Cycling and Walking Infrastructure Plan. That's had some delays to it. The county are progressing these for all the towns across the county. The timeline now for members will be there'll be some more engagement in the summer of this year. I'm looking to publish the plan in early 2026. We'll be doing some further work on supporting businesses, which is something we haven't been able to pick up in this phase of the plan. So if I can just touch on the town investment plan projects. The Beryl scheme launched in June. We've had 35,000 journeys to date. There'll be a few more than that now for the time that this report was prepared. That's 85,000 kilometres of cycling on the e-bikes and the conventional bikes. And there's over 10,000 registered users, and over the winter period there have been 1,200 people regularly using the Beryl bikes. That, of course, will be a greater number in the summer, and there'll be some work done in the spring to further promote that. A number of members will be aware that we've been seeking to put some more bays in around the city. There's 44 live at the moment. We're looking at about another 10, and we think at that point we'll be pretty much up to capacity with the numbers of bikes that we have, so that we can balance that availability of bikes at the bays with the number of bays and the distribution of those. We are looking to a really exciting project, actually, looking to use one of the reclaimed arches as part of the Archage project for both secure cycle parking and a Beryl stand. So hoping to have some secure cycle parking in one of those arches opposite Foregate Street Station, which should be a really valuable facility to enable sort of short periods of time, hiring of a day or a week. The Kipax Bridge element of the project, which was mentioned earlier, that's now fully complete with the council's contribution towards that. But I noted the point that was made earlier. That's not part of this particular element of the project, but we'll continue to talk to county colleagues around that. And then finally, there's a number of active travel corridors, 3 particular routes. We've finished the canal towpath between Purdiswell and Sixways. It's now paved all the way up to Sixways and beyond. New routes accessing St Peters and then onto Norton through Diglis and Cherry Orchard. That's been a real improvement with a new crossing over the Bath Road, funded in partnership with the County Council. And then the final phase is from Nunnery Wood, the County Hall up through Nunnery Wood, 2 routes that take you up, finally take you up to the Lippards. So extending the active travel corridors across the city. So thank you, Chair. I hope I've covered the detail there, but I'm of course happy to take questions.
Four in a row, Neil, you've been first.
Sorry, genuine questions, not just for the sake of it.
They're all great questions.
Thank you. Thank you for the report, David. And yeah, this is really obviously encouraging to read so many initiatives to help people travel more actively. So I just want to start by praising officers for all the hard work that they're doing. So just a couple of questions. They're both about the local walking and cycling infrastructure plan. So the first question is quite a long-winded question. How likely is it that the stakeholder event regarding the local walking and cycling infrastructure plan in June 2025 will lead to solutions regarding the issues mentioned by Councillor Udall in relation to access to the new bridge from the west side of the city? Will that stakeholder event in June feasibly lead to meaningful solutions that will increase access to the new bridge from the west side of the city? I'll just take that one first and then I'll come back to the second one.
Okay, thank you, Councillor Lawrence. I'll do my best to give you an answer to that question. I don't think I can give you a definitive answer. The LC WIP is a plan, so it's an infrastructure plan which will map out, as I understand it, over future years, areas that will be suitable for investment when that funding is available. So I don't think that event will directly lead to a path being surfaced and opened along that route in a short period of time, but it may well, part of the work may well identify that as a key route.
Yeah, I'll take that as progress. Thank you. Second question: how much do you, in your view, will the local walking and cycling infrastructure plan be affected by the government's plans to reorganise local government? So a lot could happen between now and June. So how likely will the changes affect that particular infrastructure plan? Fortune telling is what I'm asking for.
Thank you, Councillor. An even more difficult question to answer. I'm not aware of anything that will impact upon the progression of the LC WIP. I think that's as full an answer as I can give you.
Councillor Riddle?
Are my questions all good as well?
I'm not going to be pushed into a judging contest on questions.
My questions, which I was going to ask earlier on barrel bikes, and I think you've partially answered it, is I'm looking to identify if we're anywhere near the process of having a review of the locations of the barrel bikes within the city. I'm particularly interested to know which are the most successful ones and where they're located, and where they're least successful, and is there anything we can do to actually ramp it up a bit to give them promotion.
Thanks, you, Councillor Udall. The locations are reviewed actually monthly, so we receive data from Beryl, who of course are managing the scheme, and it's very much in Beryl's interests that the bikes are ridden as much as possible and as often as possible. Perhaps surprisingly, the most popular bays do tend to change from time to time. I'm more than happy to share some data with you. From memory, I think particular popular bays, as you'd expect, involve the university, particularly when students here, so between the city and the university campus. So those are particularly popular, but there are a number of them around the city, and they do change from time to time. So those are monitored, and Beryl use that in order to plan their logistics in moving bikes around. As you know, they relocate them to make sure bikes are available at the popular bays. But yeah, more than happy to sort of catch any members outside the meeting and share some of the monthly stats.
It might be useful information, especially if we know that in our own areas, if there's something which we can do to actually encourage participation as councillors. I'm aware that some are probably more used than others, but there's obviously some awareness issues which still exist. A question which continually comes up in conversation with residents I represent is about the loss of barrel bikes. Have you got any statistics about that, and how many have actually been lost, destroyed or stolen?
I don't have those numbers with me. I think it's fair to say that initially there were some issues at the start of the scheme, but things have settled down a lot now, and actually we do have figures on a regular basis on the percentage of the bikes that are available. That's part of the contract that Beryl have, one of their KPIs, and they get them repaired.
It's not a disturbing worry.
No.
Councillor Cochrane.
Thank you, Chair. Couple of questions about LT whip kind of process and the kind of information that would feed into that. One, you mentioned that Beryl will share data with City Council under their contract, but that may or may not include, perhaps you can confirm what the sort of popularity of routes that are used by Beryl bikes, because obviously they track the location of bikes as a potentially very useful and rich source of data to inform active travel routes. Along that same theme, my personal observation from where I live and where I cover is that two very busy active travel routes that are in dire need of improvement are the London Road going up to Spetchley Junction and Redhill Lane, which are used by a lot of Nunnery Wood students and Worcester Sixth Form College students and employees at County Hall, maybe, whilst ever it's there. And yeah, Redhill Lane, it's a public right of way, but it's completely dependent on the landowner for the quality of its surface, which degrades over time because it's gravel, and the tunnel under the railway floods, and London Road being an extremely congested route with very narrow pathways, but kids are cycling and walking at very busy traffic times there, so a plea for as much data to be used to inform the LC whip. Strikes me that schools could be collecting data on where their students come to and from, what routes they use, as even class projects would provide a potentially quite rich source of information about what routes are used. So the question is, are these sort of sources of data already planned to be used, and if not, can they?
Yeah, so certainly, I mean, I can talk to the Beryl scheme. We're engaging with the officers and the consultants that are producing the LC whip. That is a matter for those consultants and the way that project works, but we can certainly feedback, and we do feedback suggestions. Beryl have a very interesting a heat map of the rides that are taken around the city. So again, quite happy to share that with members, so you can see which are the most popular routes. Those, of course, are existing routes, whereas the LC whip will look at potential routes as well as the existing routes. So there's more data than just the heat map. There may be routes that don't exist at the moment that would feature in the potential future plan. Yeah, I'm very familiar with London Road and Redhill Road and the public right-of-way there. And I'm sure the LC whip can get data from schools. Good suggestion. We'll pass it on to the officers just in case they haven't got that in mind at the moment.
Thank you, Jack. Well, yeah, so one more question was about the city centre TPOs and whether they would, well, I would presume that they would be reviewed as part of the LC whip process, but do we need to wait for that? Can we push for those to be reviewed sooner because the LC whip process is so drawn out and so delayed?
I think my advice would be it's a matter for members really if they wish to make representations to the county council to that effect.
Councillor Subject.
Thanks, Chair. Do we have an indication from Beryl as if the scheme is successful and sustainable in Worcester at present? And I particularly note that there's a comment in the report that there may not be enough bikes for further bays, which rather leads to an indication that there's a cap on the number of bikes that Beryl are willing to supply to the city.
Yeah, so the scheme's operating successfully at the moment. The way the scheme has been funded is the Towns Fund capital grant was used to set up the scheme and procure the bikes. So there were a set number of bikes, which I think 175 e-bikes and 250 pedal bikes. Looking to Becky, yeah, to just remember, I remember the numbers right. So there's a set number of bikes, as Councillor Udall pointed out, a couple of those have gone out of service, but not very many. So those bikes are operating, which was the number that Beryl had suggested would be suitable for a city of this size. I think the balance is, if we have lots more bays, then in order for those to actually be able to operate, you need lots more bikes. Now, some of those bays might not get used very often, so you might end up with some bikes sitting in a bay for the odd time that they're used, which isn't a very cost-effective use of that resource. But all indications at the moment is the scheme's operating successfully. We would like to drive, and Beryl would like to drive more use, and we'll be doing some work on that in the spring. But there's no concerns about it right now. That's helpful.
Any other questions for David? No. Great. I think as you get to the end of a plan, when you've got an improvement mindset, you're always looking about what have we not done, what can we do better, what's next. And I think it's nice to look back at the achievements that have been made over the last 2 years, which has been phenomenal. So congratulations to you and to Becky and to the team. And yeah, thank you for all your continued hard work. Right, so if we just note the contents of that report, is everybody happy with that? Yeah. And I haven't been alerted to any other business, but has anybody got anything of sufficient urgency that they want to raise now? No? In that case, thank you all for your contributions, and the meeting's closed.